With us now from London is Sir Simon Stevens, the head of the UK's National Health Service. Sir Simon, thank you so much for being here on what I know is an incredible and incredibly busy day for you. Good morning.
Good morning, and what a pleasure. As you say, it's amazing that in less than a year since the first coronavirus cases were diagnosed, here we are today with a vaccine getting into the arms of vulnerable patients, starting off here in the British National Health Service, but hopefully available in many other countries soon.
You are about, I think, 8 or 9 hours into the vaccination process. How's it going? Have any issues come up that have been either expected or unexpected?
It's been a great day so far. We've got nurses and pharmacists and doctors across the country who are vaccinating the first group of older patients, together with staff working in care homes and NHS staff as well. And there's just huge enthusiasm on the part of patients who have been eagerly anticipating this day. Of course, this is just the first step. We're going to be getting the vaccines in a phased supply over weeks and months, so we've still got to continue to be careful as we go into the Christmas holidays, making sure that we keep coronavirus under control. I know same issues with you following the Thanksgiving break, but this, I think, we'll look back on and say was the beginning of a real turning point in the worldwide fight against coronavirus.
Let me ask you about that idea of continuing to be careful, because that seems to echo what we heard from Prime Minister Boris Johnson. We played it earlier, warning people basically don't relax just yet. Are you concerned that there may be a sense of complacency that sets in that could complicate the recovery given the images that people are seeing of these vaccinations happening?
Yes, I think we've got to take today as a day of optimism. We can see the light at the end of the tunnel, but it is going to take weeks and months to get millions of people vaccinated in this country and indeed internationally. And in the meantime, we've just got to continue to act safely and be sensible. And we know what that means. We've still got significant numbers of coronavirus patients in our hospitals, just as you have across the United States. And so going into the holiday season, we all need to continue to protect the elderly, the vulnerable, by keeping the infection rate down.
Yeah. The UK obviously went through a quicker vaccine approval process than what we've seen here in the U.S., as you know. It's something that one of our top doctors in this country, Dr. Anthony Fauci, reacted to last week, saying the U.S. didn't do it as carefully. He apologized, of course, saying he has a lot of faith in the scientific and regulatory community where you are. But I wonder what your response is to these questions on why and how the UK made it there first.
Well, this is obviously an international scientific collaboration involving researchers in the United States, in Europe. We have an independent safety regulator, a quality regulator here, just as you do with the FDA. And our regulator has been looking over the shoulders of the researchers and the scientists at Pfizer and BioNTech as they've been doing the clinical trials for this particular vaccine, so they were able to come to their conclusions independently and thoroughly, but quickly. And obviously the eyes are now on the FDA, who equally have got a strong international reputation for the rigor that they apply.
Sir Simon, I'm just about out of time, but I have to ask you quickly. We saw Maggie Keenan at the top of the show. She's obviously the first person to get the vaccine. How did she specifically end up being selected as patient A? Why her specifically?
Well, obviously, thousands of people are getting the vaccine first thing this morning, but if you are elderly and you are in hospital, then you were eligible. She's obviously an early riser, so at just after 6:30 this morning, she was ready and willing for her vaccine, and she became the world's first patient for this clinically approved new vaccine and goes down in the history books as a consequence.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.